here we go. More live on Facebook. Here we go. Preparing to live stream meeting. Almost there, almost there, almost there. Okay, we are live on Facebook. So hi everybody and welcome back to Ilse. Lovely to have you here with us this evening for our live Q&A.
Awesome, thank you for having me.
So we're going to just quickly start by introducing ourselves very quickly so that everybody knows who we are. So I am Dr. Katrin and I have been a vet for over 20 years. I own a small animal practice in Abu Dhabi in the United Arab Emirates, and I am currently in the process of specializing to become a veterinary behaviorist. So I'm currently doing a residency in veterinary behavior, and I have seen almost 300 cases. We were just talking, I think I saw case number 292 this week. So getting lots and lots of case experience, clinical case experience under my belt. And yeah, loving all things behavior. And that's what we're here for today. So over to you, Ilse, just for a quick intro for everyone.
Yeah. Hi, I'm Ilse. I work with Dr. Katrin as her trainer and behavior modification specialist. I've got my CCBCKA. Look it up. So many letters. I've got my diploma from the Center of Applied Pet Ethology, and I joined Dr. Katrin just over a year ago. Yeah, so that's it.
Exactly. So you get the benefit of both of us today. So you get my input sort of from the veterinary behavior side of things, and then you will get Ilse's input on the behavior modification and learning theory, I guess, more angle of things. So we've got some amazing questions lined up today. We do have space for a few more. So if you want to type in any questions, please feel free to do so. But yeah, without further ado, I think we'll get started. I do have a couple of really exciting things to share throughout the chat, which I will be posting links for. I've got some amazing workshops and courses coming up. So we're going to talk a little bit about those, where they fit in with the relevant questions. But we are going to start off with a question from Amber, who says, hi, we adopted a rescue dog 2 weeks ago. Congratulations. We've been watching a ton of videos about it, but it's still hard to understand how to start with his training. He does not seem to really love us that much yet, or be really cuddly, for example, which makes it hard to work on commands like recall. How do you recommend to handle training in the first weeks of adoption, and how long does it usually take for the dog to really show signs of comfort and affection around us? So what a lovely question to get us started. And thank you for asking that, Amber, because I think it's really important that we do take those things into consideration. We absolutely want our dogs to feel comfortable around us. And it's probably not until that point that, you know, they really start to learn easily and to trust us and to have that sort of relationship. And that takes time, as it does to build any relationship. And I think the question of how long is very much dependent on the individual dog, and perhaps you guys, but also how you set up those interactions, how you start to build that trust and that bond. And I'm going to let Ilse talk about, you know, some really great relationship strengthening exercises. But I do want to let you guys know that we have an amazing 6-week online workshop coming up, which is called Learn to Speak Dog. And in Learn to Speak Dog, we address exactly all those types of things. So we talk about communication. How do our dogs communicate with us? How can we understand them better? But also, how can we effectively communicate with them? We also talk about social relationships. We talk about canine emotions, what can they feel? And then there's going to be a whole session on enrichment, meeting the needs of our dogs and how we can enrich their lives. So that might be something really lovely, Amber, for you guys to join in on. And I'm going to drop the link in the comments just now. And I'm going to let Ilse chat to us a little bit about the relationship strengthening exercises and the communication piece.
Yeah, Amber, I think, the important thing is to really give the relationship some time, and don't get too stuck on kind of what we would refer to as obedience, right? You can teach a dog to sit or do anything like that at any particular age, right? The most important thing is building that relationship. And when we do training with our dogs, we refer to the 3 C's. So, all the exercises that we would do either feed into connected or connection, which would be the relationship building, calm, and confidence. And we need to bear in mind with rescues, remember the whole world has been turned upside down, right? It's only been 2 weeks. It's really, really a very, very new relationship, not just with you, but, you can imagine, where am I? What's going to happen next? It's the first kind of sense of potential stability that the dog still isn't aware of, so it's also building that feeling of security. So all of that is going to take time. So my recommendation would be, don't think about the obedience stuff just yet. Do some relationship building exercises, such as what we refer to as orientation, or I call it compass work, where, anytime your dog orientates to you, you can mark with either a yes or a clicker and reward. That's going to, build the relationship between actually finding you. So I always say, we're teaching the dog that you are true north, and the dog's like a compass needle. So the more the dog orientates to you and come closer to you, there's really, you're really reinforcing that relationship. When your dog is just calmly lying in their bed, give them some rewards. You're also, capturing that calmness. And sometimes just give rewards for no reason, right? Just for your dog actually existing, so we kind of refer to that as non-contingent. So your dog doesn't have to do anything, work for their treat, so to speak. So just, I would also, kind of hand feed. You can maybe teach a nose target, which is quite nice. So, any interaction, anything that your dog would, moving closer to you, following you around, so you don't have to feed. And other thing is, as we always do, we never encourage feeding out of a bowl. So ditch the bowl, so to speak, and feed out of Kongs. That's going to help give confidence and, get used to the environment around your dog. So, licky mats, nice little chews, lots of hand feeding. So what I mean by that is like lots of little training exercises. Again, toss a treat. As your dog turns to you, yay, give a bigger reward, toss a treat, or even just the kibble, right? Toss the kibble away as they turn around, yay, and give a reward, right? So it's really about just getting that confidence, that comfort, and that connection and calm with you. Don't worry about obedience. Recall can come later. You first need that, and give it time. Once your dog feels more secure, you will find that doing, things like recall and whatever training you wish to do with your dog is going to be so much easier.
Yeah, I totally agree with you, Ilse. And the thing that I love about the orientation game, so the game that we use to sort of initially start building connection and communication and relationship, is actually a great foundational piece for recall. So if your dog learns that being close to you is something that's really reinforcing and is a great thing, the best thing in the world is to be close to mum, then that's going to make your recall work in the future so much easier. And I do think, there are a couple of behaviors or training pieces that Ilse and I call almost like life-saving training pieces, which is a recall. It can be a leave it, if your dog has something dangerous in their mouth. And the third one would be the emergency stop, so that wherever your dog is, if there is danger, let's say, you know, they're somewhere sort of out of sight and you see there might be a car or something, being able to give an emergency stop so that your dog just kind of freezes and stops. That's a great thing to teach them. So again, it's not so much about obedience, I guess. It is about teaching skills to keep them safe and also to help them cope in our modern domestic world, which, let's face it, isn't always the easiest place for a dog to live. So we hope that answers your question. Please come back to us if you have any further questions. And if you're interested in any of the exercises, feel free to get in touch with us. You know, we can set you up with a one-off session with Ilse just to get some of those things going. And yeah, again, that 6-week online Learn to Speak Dog course might be a really valuable thing, just so that you can start to build some really great foundations with your doggy.
Yeah. I think that's really important. Sorry, just to add on to it, I think it's really important, you know, to know what your dog is trying to communicate, right? So even, you know, whenever I'm training with my dogs or working with one of our patients or clients, you know, it's really important to know, because that's how you know what their emotional state is like, right? So you want to teach them X, Y, Z, and if they're not giving you that feedback, it's really, really important to be able to read those subtle signs of what your dog's telling you within a session. So I think definitely the Learn to Speak Dog is so beneficial for anyone living with dogs, anyone new to dogs. And it's all, you know, based in science. So yeah, I highly recommend it.
Amazing. So yeah, I was going to say, send us a quick hi and where you are joining us from. I know we've got lots of people joining us from all around the globe. So just send us a quick hi in the chat and let us know where you are joining us from. I always love to see that because it's so much fun to see familiar faces and names. So yeah, just send us a quick hi. Okay, so we are going to move on to our second question, which comes from Megan. And Megan says, hi there, I have a 16-month-old male Cocker Spaniel. Recently, I moved out from my partner, and so it's just me and the dog now. I've noticed how his behavior has changed. He was pretty well trained previously, but now he started jumping up all the time. He'll sit and bark at me, and he started biting my feet every time I get dressed. I'm pretty sure he's asserting his dominance, but I don't know how to stop this behavior. I would love some tips. Fantastic question, Megan. Thank you so much, because there is a lot for us to be able to talk about, I think, with this question. So again, I'm going to start us off a little bit with the theory and just sort of conceptual ideas around what you've asked. And then I'm sure Ilse's got some practical tips for you to take forward. So the first thing, I guess, that jumps out at me is your doggy's age, Megan. So 16 months is right in the middle of what we call the adolescence period. So dogs, very much like children, go through very set developmental periods in early life. So we have a socialization period, which is from about 3 weeks to 16 weeks of age. And then after 16 weeks of age, so from about 5 to 6 months of age, when the dogs become sexually mature, is when adolescence begins. And adolescence in dogs can go right the way through to about 2 to 3 years of age. So it's a relatively long period in a young dog's life. And adolescence, just like with people, can be a tricky time. And the reason for that is that there are lots of changes going on in the brain during adolescence. So we have an almost complete remodel from the puppy brain to an adult brain. And things that occur in the brain can be quite challenging in terms of emotional regulation in particular. So we normally have, we have kind of two, this is very schematic, two sort of rough areas in the brain. We have the emotional part of our brain, which we call the limbic system. Our amygdala is within that. That's where our fight-flight response originates from in the brain. And so this kind of emotional part of our brain controls exactly that, our emotions. We then have what we call the thinking part of our brain. It's obviously a little bit more complex than that, but that contains the prefrontal cortex and other cortical structures. And the thinking part of the brain can come in and modulate or regulate the emotional part of the brain. So if the dog reacts extremely emotionally to a trigger, it is possible for the thinking part of the brain to come in and say, no, hang on, you don't have to react like that. Experience and prior learning has told me that that's not something that we have to be afraid of. And then that helps the animal or the person come down from that sort of heightened emotional response. Unfortunately, during adolescence, the communication between those two brain areas is not very good. So we might have a totally different emotional output because we don't have that modulation and regulation that comes in from the cortex. And that is why sometimes emotional responses can be heightened and seem disproportionate or out of context or dysregulated during adolescence. So that's the first piece. Your doggy is 16 months old, right slap bang in the middle of adolescence. So that might have a bearing on the expression of his behaviors. Now, the second thing is that we've had a pretty big change in lifestyle or environment. Let's say there's been a life event, there's been a change to his care system, if you like, and that can obviously be unsettling. Perhaps also changes in routine might come with that. And yeah, that can be unsettling, and that may increase levels of uncertainty, maybe not feeling quite safe and secure, having to learn new routines, becoming familiar with a new environment. So all those things can heighten anxiety. So that is what I would think about when I'm thinking about the behaviors that you're seeing. So we don't think of dominance when we think about dogs. This is a really old-fashioned way of thinking about dogs. So it is that the whole dominance theory is something that originated way back in the 1960s, 1970s, and has since been absolutely debunked and disproven. So we think much more of our dogs living in as a family unit, as a social group that doesn't have a linear top to bottom structure. So there's no alpha on the top and then others that come beneath. But think of it more like our own family units a little bit. So, you have different people within the family who have different roles to play. And, some things may be more important to some people within that social group than others. And that's really, where we think our social system in dogs actually lies, rather than a linear dominance thing. So I do not believe, Megan, that your puppy or it's not a puppy, that your adolescent dog is trying to assert dominance. I think rather he's communicating how he's feeling as a result of sort of the upheaval or the change in circumstance that he's gone through. And I also wonder, so this is just a thought, I also wonder whether in this new constellation of it being just him and you, whether he maybe feels freer or more confident to actually express how he's feeling. Maybe, and I'm just putting it out there as a supposition, maybe in the previous context, he didn't feel so much able to show how he was feeling and to behave in the way that is perhaps more communicative. It's possible that his behavior was previously perhaps more shut down. So there are a lot of things to think about. And, again, that would, in a conversation with yourself, Megan, we could kind of tease out those things and try and really understand what was going on. So that's just a little bit my thoughts as to the background and the things that we need to consider. And I'm going to hand over now to Ilse to give you some practical advice on things that you can do to help him feel more safe and secure, but also how to manage some of these behaviors that you're finding, as being nuisance behaviors, perhaps a little bit.
Absolutely. He's in those moments where he's jumping up and he's biting at your feet. There's something that he's trying to communicate, right? So whether it's looking for comfort or frustration or whatever that may be. Again, it depends on the history, and it would require a little bit of a deeper dive into it. The best thing in a situation like this, when it comes to particular behaviors that we kind of would say, nuisance behaviors or behaviors that we particularly don't like, is to be preemptive. So what I would recommend is almost have like a little trigger tracker, so to speak. So kind of identify when that occurs. You've already identified it's, when you get dressed or get ready to go out. So, prep a little Kong that you have in the freezer, maybe with some peanut butter or tuna, or even some of his, kibble in there with some wet food, so that you can give him something to do while you get dressed, or, if it happens while you're watching TV or whatever the case may be, that, then give a licky mat, or, give a little chew or a kneecap or something in that kind of situation. So we preempt it, so he doesn't practice that behavior. I would also recommend to do, again, some relationship building. Watch out for his body language. What is he trying to communicate to you? Again, the compass and orientation work is fantastic. I would also ensure that he has, whether he has a crate or a bed, that is really his safe and calm space, and really, really reinforce that. So you could literally do, if you've got like his little bed and you're busy and you're watching television, I always try and find, kind of ways to, because we need to incorporate training into our lifestyle, right? We can't just go, okay, we're going to train for an hour and that's it. We know learning happens continuously. So maybe have his little bed next to you, or even if he's on the couch, wherever he is, and, just have like his dinner in a little, Tupperware or little tub, and just kind of drip feed next to you. Just, drip feed. When he looks away from you, give him a little bit of kibble, give him a little bit of a treat, just so that we really focus on that calm. So be proactive and preempt those moments, and definitely, capture those calm moments. A lot of us always, I think a lot of owners, we want a calm dog, a dog that will just kind of lie around and be in the bed. And what we take for granted is, if we're not going to reinforce that, it's not really going to happen, because we know that whatever, behavior, and actually just relaxing in terms of, kind of from a physiological point of view, if we actually capture that and reinforce that, that is going to repeat. So, I would definitely have a look at, just capturing those moments.
Absolutely. Yeah. And I think, kind of giving him something else to do with his mouth, whilst you're getting dressed, such as using a little Kong or a licky mat or a snuffle box, snuffle mat, anything that you want to do, so that he's occupied with his thing whilst, you're doing the things that you need to do, like getting dressed. I think, just setting up the environment to be successful is a really good place to start as well. Mm. So I hope that helps, Megan. If you have any further questions, please let me know, and we can definitely chat some more. But yeah, that's a great question, and lots of things to be taken into consideration there for sure. Alrighty, so we're going to move on to the third question, which comes from Sarah. And Sarah says, hi, I'm socializing a 10-month-old Labrador who is lovely, except he loses his mind every time we see another animal, mostly other dogs. He barks, he whines, he squeaks, and he lunges. We do lots of distraction, avoidance, praise for calm, but even at a distance and often long after the dog is out of sight, he's still whining or barking until he wears himself out. And she says, we've socialized 10 other puppies, never had this type of extreme behavior before. He's great at home. He sleeps in a crate. He's good in shops, buses, and on trains. although he will jump if he meets strangers. Any advice would be great. Yeah, interesting, really interesting question, Sarah. And I think the first point to note is this dog's different. You've socialized 10 other puppies successfully. You've never encountered these types of behaviors before. And, you know, this dog is different. So that's the first thing to note. How or why, I can't answer now. We would need to do a little bit of digging. However, we do know that we've been living in very strange times. So he's 10 months now, so his socialization period would have been sort of between 6 and 10 months ago, 6 and 9 months ago. And I guess, you know, one of the questions is, were you guys experiencing lockdown? Were you on a very sort of restricted social schedule in that time? Is that something that potentially may have played a role here? Or it's possible that this little doggy is genetically different, perhaps genetically predisposed for being less emotionally resilient, or epigenetically predisposed. So it's possible that, you know, whilst his mum was pregnant with him, she experienced a stressful event, and his HPA axis, so his stress hormone cascade and axis, you know, may have been affected in a certain way to predispose him for being more sensitive to stress and less resilient. So those are just some thoughts. And then the other piece of the puzzle is, seems to be very specific to dogs and other animals, but it would be worth getting a little bit more information about what his sort of general emotional state is like. Is he more excitable? Is he perhaps more fearful? Is he generally a more anxious dog? And is that having some kind of effect or playing a role? And if he isn't, if he's otherwise very, very calm, and the only thing that really causes him to behave in this way is the sight of other dogs or other animals, then that's something very specific that we would need to consider working on. And, you know, again, I'm sure Ilse's got lots and lots of ideas on how that could be done. But to me, it's all about teaching appropriate coping strategies in this context. So we would need to identify what is driving your dog's behavior. Is it frustration? Is it fear/anxiety? What is it about this particular behavior when he sees other dogs that is reinforcing to him? Does it make him feel better? Does he feel he's more in control of perhaps the situation, or is he frustrated because he can't be more in control of that potential social situation? So there's quite a lot to kind of think about, and think about what is it about that behavior that is motivating him to continue doing that behavior. So yeah, those would be my thoughts. In terms of addressing things and giving you practical tips, I'm going to hand you over to Ilse, but always think about the principle. Before we can change any behavior, we have to understand what's motivating it. If we don't have that piece, then it's going to be hard to change it, because just trying to extinguish behavior and firefight behavior and stop behavior without addressing the root cause is almost, you know, like trying to stop a dog vomiting, you know, without addressing what might be underlying that vomiting. So the behavior is always the symptom, and what we have to try and do is figure out what is the cause or the motivation for the behavior. So over to you.
Yeah, I think just to add on to that, you know, he's also 10 months. So
Yeah.
Again, we're sitting with an adolescent, right? And it's not to say, oh, adolescents, you know, let's, you know, kind of blame everything on adolescents, but we have to take that into consideration. It's, as Dr. Katrin said, it really depends on what the underlying motivation is, because then your behavior modification strategy will shift slightly. You know, if it's you know, fear-based in terms of, you know, distance increasing, we want to create distance between him and the other dog. There will be slightly different strategies. If it's more frustration, and then it's actually distance decreasing. We actually want to get closer to the dog, but he's also whining. And again, we're going to have to, it depends on the body language. It depends on the pitch of the whine. There's quite a lot that we would need to establish, but your strategies will be slightly different depending on that. But regardless of whether it's frustration or whether it is, fear-based, we have to always think of time and space. And I know if you guys watched the talk that Dr. Katrin had with Andrew Hale, it's, exactly that. We need to give our dogs the time to process what is happening in their environment. I think a lot of times, we go see a dog, distract. Okay, maybe the dog associates the food or the cookie with the other dog. Maybe, your body language is actually making them a little bit more, it might, excite them or, heighten their arousal level. They might not even notice the other dog because you're just stuffing cookies in or like treats in their face. So, it's a tricky one. So what we really want to do is, have kind of structured setups. And I know it's difficult when we go to a dog park or whatever the case may, dog park, maybe get a friend of yours that has a dog and they work at and I'm talking about like 200 meters, like we have to create that space, right? And then actually give your lab the time to take in what is actually happening around. And then before you do that, one of the other things that I would really establish is, again, that orientation. So we refer to it as engage, disengage. So when your lab does decide to disengage from whatever, stare or, dog or whatever the case may be, when they do disengage, that you are there to then reward. So we rewarding something very specific. We're not, it's not just, see the thing and then a cookie. It's actually them opting for you. And, if it's frustration, I would work a little bit more on that. I mean, again, it depends on what the motivation is, but if it is frustration, I would kind of not within that context and within different contexts, really work on that connection with you where, it's, again, it also depends on why the dog gets frustrated. It's a really tricky one. But is it a case of then maybe moving a little bit more? Maybe your Labrador needs a little bit more movement when around other dogs. So is it maybe some spin and twist games that you can do, a little bit more higher engagement with you? So it really depends. But always in terms of, and if you are walking and you see another dog, by the time you see the other dog, just do a U-turn and give space. Just give a U-turn, give space. That is one of the main things. What's also very good is if you give space and you move away, it gives that relief, and then scatter some high value treats on the floor, because that sniffing and that getting the food is very decompressing in that situation. So as I said, there's different ways of approaching it, but just, main thing is creating that distance. And, it will need to be quite, systematic how you would work with really, really far away. Because the second he's barking and whining, he's over threshold, right? There's nothing you can do. Then there's literally nothing you can do. You can stuff chicken in his face all you want. No learning is going to happen. So that's why you want to do that U-turn. Get him away, scatter some food on the floor, let him decompress. When he looks back up to you, good boy, more food on the floor. So that, it's, you almost want to then start reinforcing the bounce back in that moment. Yeah, I think that is it from my side with that. I hope that answers your question. I hope it gives you some ideas and some tips.
I've just had another thought, actually, Sarah, and that is pain. I know he's only 10 months old, but he is a Labrador, and we are seeing a lot of pain-related reactive behaviors. And we're actually, Ilse and I are working on a workshop, particularly for reactivity, because it's a topic that we feel needs to be rethought. And sometimes it's not as simple as just doing the desensitization exercises. that would be something that I would definitely consider. So maybe, you know, seeing your vet to do a full physical exam with specific focus on, are there any areas in his body that he is more sensitive? And I'm thinking particularly in Labradors about elbows and hips and stifles, knees. So those are the three most commonly affected joints in large breed dogs. And absolutely, we are seeing problems as young as that. And that's, you know, a big reason why some guide dog puppies don't continue further on their training, is because they have very early onset signs of osteoarthritis, joint problems, all that sort of thing. So it is a thing. And again, you know, when we're thinking about the fact that this puppy's different, why is this dog different from the previous 10 dogs? It absolutely could be behavioral. It could be to do with, you know, the socialization period having been different from all of your other dogs. It could absolutely be to do with those behavioral things that we've just spoken about. But I would be really, really interested to think about physical as well. The other thing is he an itchy boy? Could there be a skin problem? Is he a boy that has a sensitive tummy? You know, is he prone to having diarrhea or vomiting, anything like that? Those are the things that I would also think about. So yeah, we've got to kind of spread the net a little bit wider, I feel, when we're thinking about these specific cases. And, you know, again, it's interesting the number that you've sort of shown us. You know, you've had 10 other dogs, they've all been fine, and then comes one, and it anecdotally seems to be that sort of thing. You know, 20% of dogs seem to be different and just not as able to cope. I feel maybe here in the UAE it's slightly more, but and there is no research to back this up. This is just sort of an anecdotal viewpoint that there are just some dogs that are different, and often that does have a physiological cause. So yeah, just a few other thoughts there, Sarah. So lots for you to think about. And again, very happy to talk to you further about this if you would like to. We are for sure here to help. Okay, so again, guys, send us a quick hi from wherever in the world you are. I would love to see where you're all tuning in from. So just send us a quick hello from whichever country you're in. Okay, so we're going to move on to the next question, which is a kitty cat one. So we're moving away from dogs and we are moving on to cats. And this is a question that perhaps some of you may relate to. So this question comes from Rachel. And she says, 2 of my female cats who used to be friends seem now to be a little intolerant of each other at times. So Mitzi is the older cat, her health is in decline, and the other cat is Ida, who's 3 years old and has a very strong personality. They've been together for around 2 years, but I sense they're growing apart. How can I help mend their friendship? And is it possible that it's linked to Mitzi's decline in health, as she's certainly always been the boss? Question mark. She says she's got lots of Feliway pheromone products pumping out in all rooms. They have access to an outdoor catio 24/7. They've got 6 litter trays, 3 water bowls, 4 food bowls. Mitzi is separated only when she's eating wet food with her meds in. They've got plenty of space and resources. They'll often sit back together after they've fallen out. And what can I do when they're having a fallout? And is there anything I can do to help them get on better? Whew, complex question, and lots of things in there, Rachel. So cats are just so interesting. I mean, cats are just amazing. I absolutely love cats. Oh, and for anybody that's interested, I'm doing a free cat workshop this coming Monday, the 23rd. It's going to be at 7 p.m. UAE time. And we are going to talk about the 5 pillars of what we call a healthy feline environment, or the 5 things that your cats need to have in their environment to help them be the happiest cats they can be. So I will drop the link in the chat in a second. It's a Zoom call and it's free of charge. We're going to spend an hour talking about cats, and there'll be lots of time for Q&A as well. But let's get back to Rachel's question. So social relationships for cats are quite complex. And that's not to say that they're not complex for other species, but they are different, I guess, from other species in cats, in that most of our domestic species, and ourselves included, are what we call socially obligate. So that means we rely on social interactions and social relationships and living within a social group for our survival. And I think for us, you know, COVID has been a prime example for that, where social relationships have been perhaps not possible. We haven't been able to see families, especially at important times in our lives. That has an effect on our well-being. And the same thing goes for most of our other domestic species. So I always use horses as an example because horses are such a social species. So horses and their survival depends on them being in a social group. So horses naturally live in herds. They live in big social groups, and you know, their group living allows them to keep safe from predators, find the best places to eat, find the best watering holes, find the best areas of shelter. And there's a very complex social structure that surrounds that. And because that social structure is so important to horses, horses have a lot of reconciliatory behaviors that they do with each other to re-establish a good social connection should there have been a fallout. So let's say, for example, two horses have a bit of a falling out over something. They will afterwards immediately do behaviors that rebuild that relationship. So, and in horses, a lot of that is what we call mutual grooming. So you'll maybe see horses kind of standing opposite, anti-parallel to each other and grooming each other's withers. So that is a socially repairing, or, you know, like us going for a cup of coffee. If we've had a bit of a falling out, you know, we go for a cup of coffee together and we talk about it, and then we're fine, hopefully, again after that. And for horses, that would be grooming each other. So cats, because cats are different because they are not a socially obligate species. So a cat's survival does not depend on them living within a social group. In fact, many cats actually do better or can survive better if they're living on their own. So if you imagine a cat that's hunting to survive, so all of its meals comes from hunting, well, if he goes out and catches a mouse, he's not going to want to share his mouse with the rest of his buddies because there's not going to be enough to go around. So, and that's different from big cats. So we have to make a difference between our domestic cat species and big cats such as lions and so on. But cats are not socially obligate, and therefore they do not have those social reconciliatory behaviors to repair relationships if they have perhaps declined a little bit. So we'll often, not often, I have seen a number of cases where we've had cats that have been perfectly good friends, and then something has happened. Maybe the one cat's gone to the veterinary clinic, or something has happened in the home, and that event is enough to damage the relationship between the two previously friendly cats. If they come back from the vet, they might smell different, and the cat that stayed at home thinks, oh my God, who the hell are you? And, you know, they have a break in that relationship, which causes them to fall out, in extreme cases fight. And the problem is that it's really difficult to re-repair those because we don't have that natural tendency to want to reconcile with each other. So that's just a little bit about cats and social relationships, and why we do see intercat aggression, and why those cases are hard to treat, full stop. You know, there's no easy way around that. In your case, Rachel, the added factor here, I think, is Mitzi, the older cat, whose health is declining. And that in itself could be a reason that she doesn't want to be so social with the other cat. So let's say, for example, I'm not entirely sure what Mitzi's medical problems are, but let's say, for example, there is pain involved. Let's say she's arthritic, or maybe she has kidney problems, which can also be quite painful. Then that in itself is going to be a reason that she doesn't want to interact so much with the other cat. And that could lead to spats, fights, you know, whatever you want to call it, because Mitzi might be, you know, being a little bit defensive of her own personal space and her bubble. She might not want the other cat to come too close to her. And she might be more irritable if she's in pain. Her arousal levels might rise more quickly. Her irritability might rise more quickly. And she may have far less tolerance for social interactions. So that's an additional piece of the puzzle, I think, which is definitely a factor to consider in this case. And yeah, I do believe that Mitzi's decline in health could be a part of this. Now, here's the other thing, and that is in cats and dogs, we see cognitive dysfunction or cognitive decline, which is the equivalent of human dementia in animals of around 8 years and older. So depending on how old Mitzi is, she may be suffering from a degree of cognitive dysfunction or cognitive decline. And one of the symptoms of cognitive dysfunction is changes in social relationships. That can be either way. So animals might become more distant and less socially interactive, or they might become more clingy, more interactive, need more assurance, more reassurance and assurance, more safety, more comfort from their caregivers. So that's another piece of the puzzle. So I think, as you guys can see, when we think about behavior, it's really complex and there are so many things that kind of factor in there. And it starts to become a little bit like detective work where we have to sort of unpick things and start to kind of try and figure out what actually is it that's going on here, or do we have a combination of things going on here, and how do we best address those? So I think, you're doing absolutely an incredible job, Rachel, because you've got so much space, so many resources. You've all of the things that I guess, that we talk about a lot for cats, things that are important to them, plenty of hiding places, plenty of resting places, places for Mitzi to be able to get away from the other cat and the other cat to be able to get away from Mitzi, lots of choice and control over their environment in form of, multiple litter trays, multiple food and water bowls, and them being in different locations so they don't have to cross paths with each other necessarily, especially if they've had a bit of a falling out. So you're doing all of the right things. I guess the only thing I would say is, I wonder, is there anything more we can do to aid Mitzi in terms of her health to make her feel more comfortable? Does she need more pain relief, or does she need pain relief? Is there anything else we can do there? Because that will have a positive effect on behavior and on the relationship. So that was quite a long answer to a fantastic question in its complexity, because there were a lot of things in there, I think, that we need to consider, which is why behavior work is so fascinating, and why we can never just kind of say, we can't think in a linear way or sort of say, oh, it's definitely this or it's definitely that that's causing the problem. It's, likely a combination of things, and sometimes we really have to think outside of the box as well.
I also just think, from a behavior modification, side as well, it really is that it's looking at what is this animal's behavior, what is this pet's, motivation, and, the physical, mental, emotional, all of that, what is actually happening. And, in terms of, when we give these practical, advice and these practical tips, again, there's no recipe, there's absolutely no recipe. I can't, say, oh, for example, with the 10-month-old lab, do X, Y, Z, because, it always, works, or whatever the case may be. There is, unfortunately, no recipes. We've got a lot of tools in our toolbox, and we keep adding tools and we keep learning. And, again, it depends on how the dog or cat responds to what we're doing. It depends on, we have to even tweak those tools as we go along, so it is, I think that's what makes it so wonderful and so challenging to work these cases, and I mean, Dr. Katrin and I, every case is so different, and we really have to put our kind of the medical and the behavior and the training caps on, at all times. So yeah, but I mean, we are here to help as far as we can in terms of the information that we have. I think, I encourage everyone, if you really are struggling, reach out to us. We can see if we can help you further.
Yeah, absolutely. And just as a way of a little update there, so Rachel's just come back to say that yes, she is in pain, Mitzi. So I wonder, Rachel, whether you don't want to maybe speak to me and see if we can help you out. So we have other options for pain relief. It's, we need to think maybe multimodal if she, I don't know if she's on pain relief at all. I'm presuming that she is, but there are other things that we can add in and other strategies that we can use to help with pain in cats. So, and that's likely part of the explanation of the breakdown in social relationships. And then Jude says, hi from the UK. Hi, Jude. Lovely to see you here. Hope your kitty cats are all doing good and your horsies. And yeah, so that was it for the questions that we had. I have a question for you, Ilse, but I'm just going to quickly give everyone an opportunity to type in any further questions if you have any. Now's your chance. We've got another kind of 10 minutes. So if anybody has any questions, please type it in the chat now and we can get to those. Otherwise, I'm going to quickly ask Ilse a question, and that is, what are you working on with your doggies at the moment? Because I know that you're doing a whole bunch of very cool training stuff. And I haven't actually asked you this for a while, but I'd love for you to share with me and the rest of the group, what are some of the training things that you're working on with your doggies?
So, quite varied at the moment. So Rocco, my little dog, was actually, he came in for a pain assessment and we did x-rays and all of that. He's, he's also on some psychopharmaceuticals. And a big reason for that is also pain, right? So we've actually put him on gabapentin, which has made a world of difference. But at the same time, also doing some physio and strengthening exercises because he's got slight hip dysplasia. So with him, I'm doing quite a lot of, proprioception work, quite a lot of, balancing, sit to stands, taking it a little bit easier with him. And then with him as well, because I don't want to do too much movement, I'm doing quite a lot of concept and cognitive work with him. Also, he's 7. So I'm also like very aware that he needs, I'm quite, and again, it's being aware of all these medical conditions out there to be, again, I'm a big believer of being preventative. Is to teach him. So at the moment, I'm teaching him to distinguish between 3 different objects. So that's basically a toilet roll, a flip-flop, and a Tupperware lid. So I've got duplicates. Of it. And what we training is that I place the 3 objects down, and depending on the object so the corresponding object I lift up, he goes and he targets. So if it's a toilet roll and I lift up a toilet roll, he goes and targets the toilet roll. If I lift up the flip-flop, he targets the flip-flop. So he's rocking it with 2 out of the 3 objects, and of course adding random objects in as well. So he's doing really great. He's such a quick learner. I mean, I absolutely love working with him. And then with little Mr. Bentley, we're doing also, he's shepherd, so he quite likes movement and moving away work. However, I'm also doing some proprioception work with him. I'm actually teaching him to fake pee on command, so to lift his leg like a boy. which is quite a nice progression from a proprioception standpoint, kind of leg targeting. So I do all sorts of odd things. I think my dogs sometimes just think, why are we doing this? But it's all, it's a lot of fun. It's a lot of fun. So I'm working hopefully to get another trick title this year with them. But yeah, but it's and then in between, obviously the things that they know, and I still carry on with the calm, with the 3 C's. That's something, that if you don't reinforce it, you lose it, right? So still building, still working, always, in between doing those kind of exercises. Yeah.
That's so cool. I love the Rocco being able to identify the different objects, that sort of real cognitive discerning ability, which is very, very cool. So yeah, I love hearing about what you're up to with your own doggies, which is always very interesting. All righty.
That's really great.
Yeah, it is. So we are pretty much almost at the end. So I just want to quickly say hi back to Susan, who is joining us from Chicago in the US. Lovely to have you here, Susan. And yeah, just want to let you guys know again quickly about the two things. The first one is for all you cat lovers and cat parents out there, I'm running a free workshop all about the 5 pillars of a happy feline environment. So the 5 things that we have to know about in order to provide the very best environment for happy cats. So that's happening this coming Monday, the 23rd of February at 7 p.m. UAE time. So please, I've just dropped the link in the chat. So if you click on there, that will take you to a sign up page, and that will then send you the Zoom link for the workshop on Monday evening. And then the second thing, which I'm really, really excited about, is our online Learn to Speak Dog course. So we actually ran this course live in Abu Dhabi at the end of last year, and it was such a huge success. So Ilse and I co-ran that together. It was a full day workshop, and we just had such a great time. It's a relatively, awesome. I want to keep it quite small and intimate, the group. So I've limited the places for the course. We've already had quite a few signups. So if you are interested, please jump on board. And so it's going to be 6 weeks, and we have a different topic every week. So we've got a meet and greet in the first week so that everybody can kind of introduce themselves and their dogs, which was actually the most valuable piece when we ran the live workshop, was getting to know everybody and getting to know everybody's dogs and sort of the challenges and the hopes and dreams that we have for our pets. The second week will be all about canine communication, body language signs, how to read those better. The third week is then all about social relationships, deepening that, both human dog as well as dog dog social relationships. The fourth week is all about canine emotions, emotional state. What do we think our dogs can feel? What do we think they cannot feel? And really digging deep into that and why that's so important. And then week 5 is all about enrichment. So practical tools, tips, tricks, things that you guys can do with your dogs to enrich their lives. And, you know, sometimes they are such simple things that can really make a massive difference to your dog's quality of life and to how they experience their everyday. And then in the final week, in week 6, we're going to have a whole hour of just Q&A where you guys can ask, anything that comes up. We're going to host the course in a private closed Facebook group so that we can all chat with each other in between calls. You can ask questions if anything's come up. You can send videos of your dogs so that we can assess them together. So it really is a very interactive course, and we want to try and keep it small so that it is intimate and that everybody can, have their questions answered and get advice for their own personal situations. So please, if you're interested, do sign up to the link that I just posted on the chat, and I will then join you to I'm going to just post it again one more time. The link takes you straight to my new website, which is Trinity Vet Behavior, and you can purchase the online course on there. And the cost for the 6 weeks, this is the first time I'm running it online, so it's kind of a one-time offer of $149 US, which equates to about 550 dirhams, which I don't know what it is in pounds. I do. It's 110 pounds sterling. So if you're interested, please do join us there. And I'm just going to quickly pop the link in here again. So that's the link to the website where you can register. And that's all for today, guys. I hope you've enjoyed the hour with us. I hope you've got some information, some valuable information. And for the 4 of you whose questions we answered, if you've got anything, if you have any further questions, please just drop them in the chat or ask them in the group, in the pet behavior community group, and we will most definitely get back to you. Ilse, any last words from you?
No, it was just great to be here again, and I really hope that we, answer some of your questions. But yeah, I'm all good.
All righty. So with that said, we're going to say good night in the UAE. Have a lovely afternoon in the UK. I hope everybody's safe with the weather that's going on in the UK, and I think maybe good morning to those of you in the US. I'm not sure. And we will see you again very, very soon. Keep posted for more events coming up. I've got some great guest speakers lined up. So we will be having more live chats in the group, and we'll see you then. Bye, everyone.
Bye.
Ilse?